Let me tell you a story about John, a 40-year-old man who noticed something unusual. Walking up the stairs, something he always done all his life, now started getting him out of breath. Over time, even simpler tasks like tying his shoelaces felt exhausting. It wasn't just being unfit, his lungs had changed. What John didn't know then was that he had emphysema, a condition that slowly robs the lungs of their ability to breathe in and out. In this video, we'll break down emphysema down to its essentials, what it really is, why it develops, the signs you should never ignore, how doctors confirm the diagnosis, and the key steps in management based on the latest guidelines. By the end, you'll understand not just the science, but also the lived realities of patients with emphysema. The number one cause is smoking, damaging lung tissues over the years. Other risks include air pollutions, dust, chemical fumes, and a rare genetic condition called alpha-1 antitrypsin deficiency. In addition to this, age and chronic infections could also increase its risk. Let's go a little bit more detail to discuss the pathophysiology. In emphysema, the alveoli wall breaks down, leading to fewer, larger, floppy air sacs with less surface area for oxygen exchange. Air trapping causes hyperinflation and barrel chest, while the poor recoil means patient can breathe in but struggles to breathe out. Over time, oxygen falls and the carbon dioxide rises, and this worsens the feeling of breathlessness. The symptoms include progressive breathlessness, chronic cough, sputum production, and wheeze. And in the advanced stages, you could see barrel chest, quiet breath sounds on auscultation, and obvious use of accessory muscles. Other people also report the weight loss and a paused lip breathing. The diagnosis of emphysema can be arrived in 4 different ways. Firstly, through spirometry, and this evaluates the ratio of the forced expiratory volume in 1 second against the forced vital capacity of the lung after the use of a bronchodilator. If the value is less than 0.7, this can be confirmatory for the diagnosis of emphysema. Secondly, the diffusion capacity of the lungs for carbon monoxide, which is also called the DLCO test. And this is a measure of how gases moves from the lungs into the bloodstream. In emphysema, because the alveolar walls are damaged, thereby reducing the surface area for gaseous exchange, it is expected to have a reduced DLCO. The third test will be more of an imaging. An high-resolution CT scan is the most sensitive, but a chest X-ray can also be crucial to show structural changes in the respiratory organs. And lastly, the blood test to screen for alpha-1 antitrypsin deficiency, especially if the patient is young, most cases lesser than 45 years old, or a non-smoker. After a confirmatory diagnosis, emphysema is staged using the GOLD criteria into 4 stages named mild, moderate, severe, and very severe symptoms. Unfortunately, there is no cure for emphysema, but management slows the decline. Smoke cessation, inhaled bronchodilators, inhaled corticosteroids, pulmonary rehabilitation, vaccination, oxygen therapy for advanced cases, surgeries such as lung volume reduction or transplant in selected patients helps manage the symptoms. Emphysema may creep in silently, but once lung tissue is destroyed, it cannot grow back. The good news? Early diagnosis, quit smoking, and modern treatments can slow its protection. Protect your lung now, because unlike the balloons, you only get one pair. That's it on today's episode on emphysema. Thank you for sticking around to the end. I'll see you in the next one. Bye for now.